Well, the month of February is traditionally the peak time for the flu season, and we all know this year's round of the flu has been much worse than years past.
Yeah, that's why there are now ongoing efforts to make sure that people do get their vaccinations. 2 on your side's Ron Plants explains why health professionals in Niagara County are doing what they can to protect people from getting sick.
The sign pointing the way at the Niagara Falls Memorial Medical Center's Golisano Clinic building with availability of about 200 or so doses of the flu vaccine, either in the high-potency variety for the very susceptible elderly or the multi-strain dose for the rest of us. A healthy supply compared to some reports.
There have been some reports of some pharmacies running out of the vaccine intermittently. There is supply available. It's just spot shortages.
This clinic follows previous offerings in October, but obviously for the medical center, cases have been on the rise in January and now into February, 8 serious enough to require hospitalization. Some surveys indicate about 40% of the population typically get the flu shot from a doctor's office, other healthcare provider, or even pharmacies, but enough people still put it off and risk not getting the shot that can give their immune systems a better shot in fighting off the flu bug. There have been questions about the effectiveness of this year's vaccine, which is sometimes an educated guess as to which strains are circulating and require protection from, but the jury may still be out since the early research is based on outcomes elsewhere where the flu season is already over.
It does have some efficacy, and it is preventing deaths and preventing hospitalizations, and importantly, preventing that transmission to other people.
And as for reports of people getting different forms of the flu,
if there's a different strain circulating, then you could get the flu again with that other strain. There are several strains currently circulating, so somebody could potentially get the flu several times. So even if you had the flu, getting the flu shot still could help at this point to protect you from those other strains.
Okay, I checked with the latest CDC reports from Friday. They say they have 3 flu virus strains, including the nasty H3N2 version, all circulating all around the country right now. And again, the research underway into the effectiveness of this year's particular vaccine formula. But all the experts stress again, get the vaccine because some protection better than none in this particular flu season. Ron Plants, Channel 2 News.